Our guest today is Paddy Chapman. Paddy has been for more than 10 years the manager of the Major Incident Response Team for North Yorkshire County Council and the City of York. They're one of the forerunners in the UK in terms of providing trauma support to the victims of disasters. Paddy, thank you for joining us today. How would you describe the objectives of your team?
First of all, our name is a bit of a misnomer because a major incident to many of our professional partners, like the emergency services, means that a lot of people have been caught up in something out of the ordinary. To us, a major incident in the support work we do in the county can be anything from one family who is hit by a disaster in their lives, and to them it is a major incident, or it can be a major evacuation of several hundred people. So a major incident every time is different, but we are there to give support to people who are caught up in the unexpected.
And who's we?
We have a very unique team. We're made up totally of volunteers. I'm salaried by North Yorkshire County Council and City of York. However, the team itself is made up of a range of professionals from all sorts of backgrounds, from adult social care to children's services to mental health to social workers for the deaf to care workers to assistant directors of one of our districts. A whole range of people come into the team bringing their own expertise, but also working to a programme that we provide of safe training to hopefully support anyone who might need us.
And are they all volunteers?
They are all volunteers, which is one of the unique things. We have a wonderful relationship, both from our Chief Exec at North Yorkshire County Council, Richard Flinton, but also the districts and other organisations who free up their staff to come and undertake the training, which is a rolling programme of training in order to keep us working really closely as a team, because that's important, but also to make sure we're working within safe boundaries. So we meet and train for a whole day every month.
And what would a training session like that include?
We try to be different in as much as we like to have guest speakers come and talk to us about their work, particularly in trauma and emergency response, so that there's always a flavour of the other side of how things can be put together a bit like a jigsaw puzzle, how we can all work together to give the best outcomes for people. Our training itself, though, we do a lot of role play in a way, because luckily major incidents don't happen every day. So we work as a team to put ourselves in different situations and say, if this were to happen, if there was a major evacuation, you would be the rest centre manager. How would you manage that situation? What would you need? How would you get that in? Or if you've been asked to visit a family, to support a family, if maybe there's been a suicide or a sudden death, how would you manage that situation? So we practice very much the protocols that we work to. And it's never like the real thing, but it's as close as we can get.
And all your members are volunteers?
They are all volunteers. And we're very fortunate, because when we do recruit, there are more people that would like to be in the team than we actually have space for, and also have the capability, because again it's very important that we have the right people who in very, very traumatic situations for others can remain calm, can sort things out, can provide emotional support, but also practical support as well. Tiny things make a big difference when you're caught up and feel totally out of control. So a little bit of information, knowing somebody who can help you sort things out, that's really important.
I described in my introduction your organisation as a forerunner in the field of trauma support in terms of local authorities.
Yes.
But it's true to say that there aren't many organisations like it elsewhere in the country. Other local authorities seem to get by. Is that right? Is that fair?
I would say that the majority of local authorities will not have a specific team trained as part of their service provision to respond in the way that we do. We like to pride ourselves on saying we were the first in the country to be set up following the 1980s, which was a decade where so many things hit the country externally, from Zeebrugge to Hillsborough to Potters Bar. It went on. And that's when North Yorkshire County Council thought that having a professional team trained that they could call on, rather than asking staff in their day-to-day jobs to take on a role that they weren't trained in, that this would be a good idea, and this is what they did.
And of course, since then, the 2004 Act, the Contingencies Act, has made it a requirement for local authorities to have the capability to deliver this work.
That's right. There is a requirement for local authorities to have a humanitarian support team in place. The police work to this as well now. Their work is very much along the humanitarian side. And so, but we sort of think that in any major incident, in any situation where people are caught up in the extraordinary, that so much time is put into the process of putting things right, that the people caught up in it sometimes can be left floundering. So that's where we come in and work as support, but also as a conduit between the emergency services and people affected by any incident.
And what is it that gives your team that particular edge over a social worker, somebody who works in adult services or children's services, who comes to the emergency situation without any particular experience of having worked in that pressured environment before?
I think the major thing that makes us a little bit different and gives us a bit of security is the fact we meet and we train together. We know what we're doing, we have procedures, we also know what not to do. For example, in the past we have been called along to support at rest centres if there's been an evacuation for flooding or a gas explosion, whatever it might be. And sometimes we've witnessed staff working really hard to do a job they haven't been trained in. But can you imagine if it were you and it's absolutely pouring and you've had to be evacuated because there's been a flash flood? But in order to make sure the registration of who comes into a rest centre is properly done, you're left standing outside the door in the rain with your family at 2 o'clock in the morning. Now, it's done with the best of intentions, but you know, if that were me, I wouldn't be very happy. So really what gives us a strength, I think, is thinking, if it were us all the time, what would we want, what would we expect, and how can we do things differently? Make sure everything is done absolutely properly, because we are very accountable, but also make sure it's done in a supportive way.
Do you find yourselves under pressure now because of the requirement on local authorities to examine every pound they spend? There's a huge pressure now on local authorities to save money. It requires great political leadership, doesn't it, to continue to invest in a team like yours?
It does, and we are very fortunate because we've never been told that the team must either cut its time or its budget simply because there isn't the money there. And I think it's to be fair, I think it's a recognition of the work the team does, that we don't let people down, that we're there 24 hours a day, every day of the year if needed, and that we're a cost-effective service, but there is a recognition that there are fewer and fewer people doing more and more work. So it's a bit of a balancing act, but again, you mentioned politically, we're very lucky because we are supported from all areas of the local authority.
So what would you suggest to your colleagues around the country who may be interested in following your lead and setting up a similar scheme somewhere else in the country? How would they go about it, and what are you've spoken about the benefits that you deliver to the people you work with? What about the benefits to your team? Do they get kind of career development benefits out of it?
I have to say, I think our training is very good because I think it transfers, most of our skills are transferable. It seems a bit of a buzzword, but it's actually true that helping even in the personal life as well as professional, the day jobs, I think the training we give does help people to develop in different ways. Politically, I think for other areas who might be thinking about this, there has to be a political will. There has to be support from the top, because managers at lower level are pressured to keep their staff on track, doing the job, ticking the boxes, if you like, to make sure that targets are met. But if there is a will from the top, I or any member of the team would be really happy to come and bore people about how we work and what we do, what we get out of it, but also what we put into it, and the fact we guarantee to give a robust response when we're called by either the police, fire, emergency planning, local authority partners.
Paddy, thank you.